Good morning, good afternoon, good evening, ladies and gentlemen, my dear colleagues around the world. I'm Dr. Weidong Yu, Vancouver, Canada. Today, I'm very honored to attend Third World Traditional Medicine Forum. Thanks for Dr. Dong's invitation. My presentation today will be TCM strategies for eye disease in the digital age. Since 20 years ago, we are moving from industrial society to an information society. Almost all our aspects of life has been digitalized piece by piece. From the emergence of computer, information highway, to cell phone, to internet, to today, big data, artificial intelligence, our life has been digitalized in all aspects. If you go to work today without looking at the computer, your boss think you're not working. From the morning we open our eyes to the sleep, the cell phone is with us all the time. The screen time is 8.5 hours per day on average on a global basis. In North America, it reached 11 hours per day before the pandemic. Those overuse long-term reading, especially on digital screen with blue light, has caused enormous vision health problems, dry eyes, eye fatigue, even called digital eye strain, Zoom conference fatigue. That set the tradition for many eye disease to happen. That's the challenge we're facing today. I call it a pandemic. In addition to what we're facing, the pandemic we're facing, this is an invisible or silent pandemic we're not prepared for. And it's not even being recognized in the governmental level, in policy making level, and by even the medical community. But the public feel the pulse. It's inevitable. Everybody are using a cell phone, a computer. In North America, in Canada and the United States, 1 in every 2 people feeling the dryness in the eyes and eye fatigue. That's what we call digital lifestyle. Digital lifestyle is a lifestyle, we call it digital screen dependent lifestyle. We put our work, our study, our socializing, our communication, everything, even shopping on the screen. Just like now, we have a conference. Instead of face-to-face in a hotel room, now we are scattered all over the world, connected together with a Zoom, with a digital screen. It certainly has its advantage, its positive contributions, but one of the organs suffers due to this digitalized lifestyle is our eyes have been overused. Every day we use more than half of life watching a screen, which has a small print, has blue light, and cause a pandemic scale of health problem. Look at this. In 2018, on average, our screen time is 8.4 hours. 2019 is 10 hours. 2020, in the middle of pandemic, it's more than 13 hours. and it's still uprising as we are more and more used to this digital lifestyle. Before, let's say I may order something from Amazon once a month, now every week. Before I go to Staples, do some grocery shopping, but now I learn how to use the cell phone to order everything. Another driving force for this pandemic is aging population. As the boomers all get into retirement and more seniors in the society. For example, in the world today, in Japan, we have 36 million seniors. In China, we have 251 million. Canada, 6.8 million. USA, 46 million. Globally, today we have 700 million seniors. That's the start of boomer wave into the retirement wave. By 2050, we predict 1.7 billion people will become seniors. Comes with it is age-related eye disease and health problem. Let's see, the World Health Organization had reported 2017 on the eye disease conditions on global report. Cataracts, we have 65 million cataracts global prevalence. And glaucoma, we have 76 million. Diabetic retinopathy, 146 million. Macular degeneration, we have 196 million. Age-related macular degeneration are called cancer in eye disease, which means there's no treatment. And it's arising, it's continue growing as more and more seniors go into retirement. Total population of all disease age-related from 2019 to 2050 was estimated to from 60 million to 188 million people. That's India and China, the seniors are growing. This is Canada and the United States. It's all up to 25% of the population will be seniors. This is the prevalence of eye disease in Canada and the United States: dry eyes, myopia, age-related macular degeneration, cataracts, glaucoma, and diabetic retinopathy. This is dry eyes. Globally, we have estimated 325 million people has dry eye disease. Myopia. Myopia has increased during this COVID-19 lockdown too. And we call it quarantine myopia. And there's an increase in China. There's a study during the 2020, the myopia in children incidence has increased 3 to 5 times. And many elementary schools, the new enrollment for the first grade students already have close to 50% of the class with glasses. Myopia not only a problem, it was estimated a growing problem by 2050. On global basis, 50% of the population, global population, will be myopic. It's good reason to believe, due to this COVID-19 lockdown, and the transition, acceleration into the digital lifestyle, this number will increase. By 2050, probably will be more than 50% of the global population. The worst area is in the Asian Pacific. Asian Pacific countries like China, Japan, Singapore has a much higher rate of myopia. Think about it. 50%. One in every two people have glasses in the future. What can we do in addition to prescribe, make the glasses for those people? Can we do better? Global market for the eye disease will increase from $3.7 billion to $5.1 billion from 2019 to 2025. With this dry eye disease, myopia, and all other eye disease, this pandemic lockdown has changed people's behavior, has made more dry eyes, eye fatigue, that set condition for the explosion in the future of eye disease. So in summary, a digitalized lifestyle, a growing aging population, and the lockdowns from COVID-19 pandemic, these three factors has driven fundamentally, globally, to an explosion of pandemic eye disease and vision health issues in the coming decades. Are we prepared as a medical profession? Are we prepared in the governmental level, policy making level of all governments? No. Number one, with all the enormous increase the demand for eye disease and vision health, our supply, our medical profession, the supply is short. Number one, our knowledge and technology are failed to meet the demand, to help resolve people's vision health problem, the eye conditions. Let's say for macular degeneration, for dry eyes, dry type of macular degeneration, our medical profession will say to the patient, we have no treatment for you. For the wet type, we have limited solution, but once they cannot help to a degree, we tell the patient, that's all we can do. You will get blind, we cannot do anything anymore. So our technology are very limited. Our knowledge are very limited to meet this demand of eye disease uprising. Not only that, there's shortage of ophthalmologists. We don't have enough trained professionals who take care of this eye disease. Whether from the education, from the research, we are slow to meeting the demand, the rapid rising demand of eye disease and vision health. Let's see for dry eyes. It's a benign, almost preclinical condition. What do we do with eye drops? Can eye drops help? No. Eye drops temporarily, externally to lubricate our eyes, but they cannot replace the tears. Tear has a composition of lipid, the liquid, and protein. Our eye drops only provide the solution, water solution. So that does not resolve the corneal dryness, erosion, even the ulcer. What we really need is a tear produced by human eyes, the tear production, but there's no drugs, no medical condition available now to promote tear production of human gland. That's why our dry eye, as is a benign preclinical condition, we do not have a certified solution for it. Myopia, we can use glasses, we can use contact glasses, and we can use OK glasses, but we cannot resolve the problem. We can correct optical level to make people see better, but we cannot improve the vision. Especially, we cannot prevent the myopia getting worse and worse. Once people have glasses, every year the degree getting worse. So what can we do? Can we do anything to improve the vision? Can you do anything to prevent the retinal degeneration caused by severe myopia? No. Our technology are limited to meet this demand to keep people healthy and well. Presbyopia. So we can use reading glasses. After 50, almost all humanity are used to use reading glasses to see. Can we change that? No, we cannot. Astigmatism. There's no treatment for that. There's no treatment can improve astigmatism. Amblyopia, retinitis pigmentosa. For all those eye conditions, today's technology are failed to help. Diabetic retinopathy, viral optic neuritis, color blindness, macular degeneration. Which one can we help? Our help is very limited with our current technology. In Canada, for every 100,000 population, we have only 3.35 ophthalmologists. In order to see an ophthalmologist, you need to wait for 6 months in the line. And once you meet them, you probably have 5 to 6 minutes of consultation with an ophthalmologist. And many patients are left waiting and helpless for their eye conditions. In the United States, more than 300 million population only have 24,000 ophthalmologists. In China, 1.4 billion population, we only have 30,000 trained ophthalmologists in total. So not only our knowledge of technology are limited to meet population demand, our trained, competent professionals, ophthalmologists, are also in short supply. Then there is a gap between demand and the supply. There's a huge gap. What can we do? Can we train another 50 ophthalmologists in 5 years? Can we get all the knowledge through research we need in next 5 years, 10 years? It is very hard, if not impossible. However, as a traditional Chinese medicine practitioner, through my personal experience in the past 21 years, and through we know in the research in Chinese medicine, and it is a possible ally, a potential contributor to meet this global pandemic of eye disease and eye health. Traditional Chinese medicine rooted 5,000 years ago based on traditional Chinese philosophy and 1,000 years practice accumulation of knowledge, which might help to shine some lights to help our understanding of current pandemic of eye disease and vision health. So it's a holistic philosophy of life. We can so when we moving to the future, into the digital age, I think we can looking back to the ancient tradition of Chinese medicine, get the knowledge and the strength and the technology to meet the demand of our health in vision health, the eye disease treatment. The roles of traditional Chinese medicine in the eye disease treatment and prevention. Let's see. If an eye disease development go to 3 stages, stage 1 is the subclinical stage. That's when we experience dry eyes, eye fatigue, and myopic. And then they develop to eye disease. Let's say macular degeneration, glaucoma, retinal degeneration, retinal detachment. And then they become end stage of eye disease. Let's say macular degeneration, when it's late, is incurable. Glaucoma, when it's called optic nerve atrophy, and retinitis pigmentosa, those untreatable eye disease, belong to the 3rd degree. Western medicine can treat the eye disease, a part of eye disease, but beyond, it will labeled as untreatable eye disease. What Chinese medicine can do in this situation? Number 1, in the subclinical stage, we can help with herbal medicine, acupuncture to treat dry eyes, eye fatigue, and overuse of the eyes. The significance of this early stage intervention is we can reduce the risk factors for those patients so they don't develop into the eye disease, let's say glaucoma, let's say myopic related retinal degeneration. When the Western medicine treating the eye disease, let's say glaucoma, retinal dystrophy, and diabetic retinopathy, macular degeneration, Chinese medicine can also applied parallel as a complement to the Western medical treatment. Let's say when you treat glaucoma patients and eye pressure are controlled with eye drops, and Chinese medicine can be used to prevent further deterioration of optic nerve. But when a glaucoma patient has already optic nerve atrophy and damage, when Western medicine say we cannot do much for you, we can only control the eye pressure, but not the optic nerve atrophy. And at the 3rd stage, even in this stage, Chinese medicine can be used to restore the visual field loss, to restore the atrophied optic nerve. So we can see, particularly when we're facing this silent pandemic of eye disease and vision health in the coming digital age, traditional Chinese medicine can provide the knowledge, the technology we need to meet this demand, to improve the humanity and help people become healthier, happier. Personally, as a TCM doctor, I have been treating eye disease in the past 21 years, since 1999, especially in a rare condition called retinitis pigmentosa. As it is a genetic condition, these conditions are considered untreatable in Western medicine. People have tunnel vision, night blindness, and reduced vision till eventually a blindness in the later age. Once the patient diagnosed as retinitis pigmentosa, they have trauma because doctor tell you you have retinitis pigmentosa. Nothing can be done. And then you go out. Many people are traumatized by this diagnosis. Personally, since 1999, I have treated more than 800 cases of such from 46 countries around the world. Our patients come to Vancouver. And for as hard as a condition like this, in fact, we see patient vision improvement in less than 3 days. Some patients come in with 5 degrees of visual field. In 3 days, they can improve to 50 degrees or 100 degrees. Some patients even improve to 180 degrees within days. How dramatic contrast it is. When West medicine tell you retinitis pigmentosa are not treatable, here on the other hand, Chinese medicine can help improve so much and so fast, which indicate Chinese medicine do have knowledge, insight to understand Chinese medicine, to understand the eye conditions, vision health problems different from West medicine, but it's related and effective. The difference don't mean because they are not scientific, rather they are very scientific and effective. Can complement the deficiencies in Western medicine. Dry eyes. What we use currently is eye drops or surgery to treat dry eyes with Western medicine. We cannot help produce the tears. You go to an eye doctor, you say, doctor, help me, I have dry eyes. My eye don't produce enough tears. The doctor don't know how to do. And they can all, the best they can do, offer you the eye drop. Does not work, change the brand. But with traditional Chinese medicine, we can use acupuncture, we can use herbs. What I have witnessed, observed is when you place the acupuncture needles in, almost within 5 minutes, the patient can have increased production of tears. Before I leave the room, patient tell me, Dr. Yu, I already have tears in my eyes. Not only that, we give the herbal medicine treatment. Most time in 30 minutes, our patient will say, my eye feel better. The tears will come out. Not only that, we prepare the Chinese food cures, food medicine. We use goji berry, we use dandelion, we use blueberry, carrot, tomato, cucumbers. We use food ingredients to make a cookie, make a candy. We give to the patient. Patient also can tell me, my eye start produce more tears. Yeah, most people can witness this change within an hour. Chinese medicine not only have a unique insight, understanding about dry eyes, they have technology, they have inexpensive everyday life solution to help humanity to resolve those early stage subclinical vision health conditions. dry eyes and eye fatigue. That can help us reduce the risk to develop more severe eye disease. Considering 1 in every 2 people has dry eyes, think about it. How many people will benefit from Chinese medicine? Presbyopia. With acupuncture and Chinese herbal medicine, people can see better the fine print, and many of our patients even get rid of the reading glass. That's a complement to a current management of presbyopia. Myopia. There's a huge pandemic. We said by 2050, half of the humanity will have eyeglasses, will have myopic conditions, and we do not have a solution. We witness our patient from -2 to -4, -8. Now we even see people with -10, -20. What caused it? How to deal with it? Our current knowledge are limited. Traditional Chinese medicine can provide treatment through acupuncture, herbal medicine to improve it. To improve our patients after herbal medicine, the treatment, the prescription even changed from -6 to -4, -3. Not only that, their optic nerve function, their eye pressure associated with the myopic condition has also improved. As myopic develop to the end stage, they do cause retinal degeneration and reduce the vision. Some people see everything like fuzzy glass, like a fog in front of them. When we use acupuncture and herbs, those fog clear away. Astigmatism. Astigmatism has no treatment in Western medicine, and Chinese medicine can help to reduce the prescription of the patients. Amblyopia. Amblyopia happened in the children. It was said after 12 years, those patients will never get improved and not treatable. With proper treatment, acupuncture, herbal medicine, we can improve the weak eye and sometimes equalize even better than the good eye. That is a strength of traditional Chinese medicine. Macular degeneration. We have treatment Avastin injections for the wet macular degeneration, but not for dry macular degeneration. Chinese medicine can help dry macular degenerations and also can help wet macular degenerations. It is a very good complement to Western medicine in the management of age-related macular degeneration. Glaucoma. Glaucoma, also we have medications can help reduce eye pressure, but once optic nerve is damaged, we don't know what to do in Western medicine. Or Chinese medicine can help to rehabilitate this damaged optic nerve, can also help in the early stage to prevent, reduce the risk for glaucoma. Diabetic retinopathy. This is a very difficult condition. And while we use Western medicine to control blood sugar, manage diabetes, Chinese medicine, the herbs can help improve the vision function of those patients. That can be used to complement what Western medicine treat and improve the quality of life, quality of vision for our patients. Viral optic neuritis. This is also called sudden blindness due to viral infection. But when caught in time within a week, We can use Chinese herbal medicine and West medicine to help the patient recover their vision to prevent the blindness. This is one of the most significant contributions Chinese medicine can make in ophthalmology because it can prevent people getting blind. The only thing prevent us to help those patients is we don't know. Most doctors at emergencies don't know what Chinese medicine can do for this condition. I happen to have several cases of patients who or whose family knows about my clinic and me. When they have this sudden vision loss, they come to me. We give them treatment, help them recover their vision. If we make this treatment wild and available to all the patients of this condition, we will have much less population of blind people in the world. Colorblind is another condition Chinese medicine can help, can increase the color vision for the patients. Overall, I would say traditional Chinese medicine, with his knowledge, insight, and with his technology of acupuncture and herbal treatment, can contribute to our global pandemic of eye disease and vision health. And I have personally worked with traditional Chinese medicine to treat eye conditions with retinitis pigmentosa, macular degeneration, glaucoma, macular degeneration caused by myopic, and also we have astigmatism, myopia, amblyopia, presbyopia, dry eyes, eye fatigue. We do find traditional Chinese medicine are effective in all those categories. That's why we are interested to help to educate health professionals of all category, traditional Chinese medicine, West medicine, ophthalmology, with traditional Chinese medicine and its acupuncture and herbal treatment, to set up affiliate networks in ophthalmology and vision health around the world to help the humanity has a brighter future in the digital world. That's our belief. That's also our responsibility. We are open to help. Thank you.